Hello, nice to meet you. Today, continuing from last time, I will talk about acquiring the necessary competencies for adult transition planning. This will be workshop 5. First, to introduce the format of the table, it's a simple form like this. For each category, you simply write down what competencies need to be acquired. After writing all of this down, it's necessary to set priorities. First, I'll show you a sample. Continuing from last time, it's the same student. For a 10th grade student, in terms of acquiring necessary competencies in the area of education and training, basic life skills should be gradually practiced, and most importantly, training should focus on not using diapers at night. These kinds of things are written down. I can't read everything that's here, but I'm showing you a sample of how to write it like this. I'll read a few parts here and there. For daily life, refer to the life skills chart, practice the self-care section. Last time I introduced the life skills template, remember? You go through and check these kinds of things. In the exercise or sports section, you didn't specifically write down any particular skills you need to acquire. Since there aren't any special hobbies either, you said you would try to actively look for things you enjoy. It's not quite accurate to say that you have any concrete plans yet. Among these, in the behavior section, you wrote that you would first check the reason you got angry and talk about what made you upset. That's how it's written. In the previous sessions, I introduced samples related to children in the 2nd grade of elementary school, but today, there was someone who had graduated from high school at that time, and I'd like to explain a bit about what that person wrote in the Worksheet 5, Securing Necessary Competencies section. This person is also someone who fills things out very well, specifically. But the biggest issue was that although the mother had a lot of plans, was very organized, and was good at making plans, the main problem was that her child lacked motivation. Despite having many abilities and talents, the child was reluctant to do things, and that was the major issue. So she spent a lot of time thinking about how to resolve that issue. Since this is also very detailed, I will read out a sentence or two from time to time. In terms of education and training, since the areas of interest are things like animation and writing, she said she would look into each of these directions specifically, one by one. There are things like this. She also wrote that regarding jobs, she would look for volunteer opportunities to try learning various skills. As for daily life, although she already knows most things, she planned to train herself more in self-control. So here, she wrote that it would be good to improve things like time management and money management in daily life. Since her child is mostly at home, she also wrote that it would be good to go to the gym at least 3 times a week and take walks twice a week for exercise. Since she is mostly at home, she rides things like bicycles, so she wrote that she would encourage her to do those activities more. As for hobbies, since she likes movies and animation, she thought it would be good for her to communicate with others who share those interests. Also, communication is something she does well enough, but the problem was that she tends to be alone. So she said that she should pay more attention to building relationships with other people. She also mentioned that she would seek help from professionals. Next, she wrote down things like participating more in the local community, looking into receiving government support, and figuring out how to go about these things as part of the necessary competencies to be acquired. Now, after you finish filling out the table like this, the next important thing is this. You can't do all of this at once, right? So you need to set priorities. But setting these priorities is not as easy as it sounds. So the table I created for this purpose is called the priority matrix. If you look here, you'll see possibility, whether there is a chance for improvement if you put in the effort. And on the right side, it says highlight. Do you like it? And how much do you like it? And on the far left, there's high concern, where you write down any worries or concerns. This is the kind of priority matrix I created. Now, something that's useful to use along with this chart is what's called a boundary circle. I also just made this up myself. It's very simple, but you can use tools like this to try writing things down. So, what is this boundary circle? I've mentioned it before, but parents often have a very narrow range of what they allow for their children, the boundary. But if possible, it's good to try to broaden those boundaries, while focusing on supporting and helping to improve the more risky behaviors that cross outside the boundary. I believe I've mentioned this before. So here, as you can see, I've written primary boundary, secondary boundary. For example, within the primary boundary, things like not making eye contact are included. Some parents think that things like this are unacceptable. But in that case, it would be crossing the boundary. Whereas something like not making eye contact falls within the primary boundary. So things like making eye contact are included within the primary boundary. After that, there will also be things to write down in the secondary boundary. For example, waving hands or rocking the body could fall within the primary boundary, or they could be included in the secondary boundary. Next, things like shouting. It would be good if things like that could be corrected, but shouting and similar behaviors can cause discomfort to people around them. So it's better to correct those kinds of behaviors. However, sometimes correcting such behaviors can be very difficult. In that case, those behaviors are set as a third level boundary. But the problem is what kinds of things end up outside of these boundaries. If a behavior falls outside the boundary, like putting oneself in danger or saying or doing aggressive things to others, these are actually very difficult to correct. However, it is necessary to put in a lot of effort to improve that part, because while it can harm others, ultimately it comes back and affects the person themselves, which can eventually lead to a situation where there is no one left around them. So in a society where we always have to live together, actions that make things difficult for others or put one's own safety at risk are, in my view, outside the boundaries. And I believe we need to pay special attention and care to those areas. Some people may think that behaviors outside the boundaries only occur in severe cases that require a lot of help. But in fact, these behaviors are often seen in high-functioning children as well, sometimes even more so. So, from a very young age, if our child shows aggressive words or behaviors, I believe it's important to seek various conversations or professional help and make consistent efforts over a long period of time to address those issues early on, because it is extremely important. Now, once you've written down various behavioral concerns or issues on this boundary circle, the next step is to use these as a basis to move on to the priority matrix. So far, you've written down various things, such as your child's profile, the current situation analysis, and the necessary competencies. Based on those, this form is for writing down which areas you will prioritize and focus your efforts on first. So I gave this table to the participants at the workshop and asked them to fill it out. But surprisingly, many people found it very difficult to complete. And there were quite a few who filled it out incorrectly. That's why in today's session, I will explain this table in more detail. The feasibility or possibility that I mentioned here means that if you put in effort, there is a lot of room for improvement. In that case, it is considered to have high feasibility. But if, no matter how much effort you put in, there seems to be little room for improvement, then it falls into the area of low feasibility. Next, highlight or high concern. I'm sure you're already familiar with these. The further to the right you go, the more it indicates things you like. Conversely, the further to the left you go, the greater the concerns become. Now let me explain each of these areas, one by one. What we should prioritize most are the areas where your child both enjoys and excels, and where there is a high potential for improvement if effort is made. So which area would that be? That would be area number 4. This is the area where both feasibility and likability are high. Therefore, area number 4 is one we should prioritize and provide a lot of support for. Since this is especially a strength, it can be said to fall into a much more positive category. Next, let me introduce the following areas. Let's take a look at areas 1 and 5. Areas 1 and 5 likely correspond to the various concerning behaviors or aggressive actions and words that were outside the boundary when we drew the boundary circle earlier. Among those, if it's something that's difficult to improve no matter what, it falls into area 5. On the other hand, area 1 is where there is a possibility for improvement if some effort is made. However, for people with obsessive tendencies, it's not easy to move into area 1. So, in cases of obsession, it's usually area 5. And although a lot of effort is required, if the chances of improvement aren't very high, it would be better to start with an area where there is at least some possibility. So if area 4 falls under the priority category, then area 1 is also likely to be considered a priority. Okay, so what will happen next? This time in number 6. For example, let's say communication isn't going well, or maybe you wish you were better at English, or perhaps you wish you knew how to write better. These kinds of areas fall under area 2 or 6. It's about wanting your children to do better in these things. But these aren't really major concerns because they're not things that harm others or put your child's safety at risk. However, surprisingly, many parents tend to focus on these areas. But in these areas, if you've tried to teach writing or math over the past 20 years and it hasn't worked out, it's unlikely to suddenly work out 20 years from now. In that case, it's highly likely that this falls under area 6. In terms of priority as well, these are not areas that should be focused on going forward. This area is one where you feel that with some effort, things could work out. There may be some concerns, but they're not too serious, and with a bit more effort, there's room for improvement. In that case, you can place it in this area. Now moving on to area 8, this is when you like something, but there's not much potential. Area 7 is where you neither like it nor see any potential. So, area 7 is one you don't really need to focus on. Next, is number 8. Of course, you may like it, but since the potential is low, but if, with some effort, your child could do better because they like it, then focusing on area 8 isn't a bad idea either. However, if you're setting priorities, area 4 should come before area 8. That's what I'm saying. Next, area 3 is where your child doesn't particularly like it, but you think there's a lot of potential. If you're not careful, area 3 might be something your child doesn't really like, but the parents want them to pursue. So even if they succeed in this area, your child might not actually enjoy it that much. Of course, if they work hard and grow, your child might come to like it over time. So there may be some confusion about which should take priority between area 3 and area 8. However, both area 3 and area 8 should be ranked lower in priority than area 4. So if we look at this comprehensively, it would be best to prioritize area 4 and area 1. Once area 4 and area 1 are achieved to some extent, it would be best to then expand the priorities to area 2, area 3, or area 8, and so on. That's what I'm suggesting. I'll also upload this chart in the video description so you can download it yourself and write down your child's situation here along with the boundary circle. If you do this, there's a good chance that rather than just thinking about it in your head, you'll see much more clearly and distinctly what needs to be prioritized. So I hope you make good use of these kinds of tools. All right, that's it for today. Next time, I'll explain about the WorkSys 6. Thank you.